Okay, hello folks. So we have here today with us for our virtual seminar series for November, Miss Alyssa Pollock, and she is going to be speaking on the topic of emergency management in South Africa. Alyssa Pollock is a current student in the Masters of Science program for Millersville University. In June 2013, she participated in a study abroad opportunity with Millersville University in Cape Town and Johannesburg, South Africa. The focus of her study abroad experience was to learn emergency management in South Africa in comparison to emergency management systems in the United States. This fall semester, Alyssa is enrolled in her practicum experience and is partnering with the South African Red Cross on a capacity building project. In her professional career, Alyssa has been employed by the American Red Cross since 2003. She currently serves as the Regional Disaster Program Officer for the American Red Cross Central Illinois region. In this role, she manages disaster services, service to armed forces, and international service programs for a 39-county region that serves 1.2 million people in Central Illinois. During her Red Cross career, Alyssa has deployed to disaster relief operations in Florida, Louisiana, Illinois, New York, Arkansas, Tennessee, and Alabama to assist in management of the Red Cross disaster response. She is also currently engaged in leading a disaster recovery case management program in the aftermath of a major flood in her region in April 2013. So Alyssa, I am going to turn it over to you. Welcome, and thank you for presenting today.
Thank you, Shauna, and thank you for the lovely introduction. Good afternoon, everyone. My presentation today is titled Emergency Management in South Africa, and I'm really excited to have the chance to present my research on this topic. As you heard in the introduction, this summer I was part of a Millersville University study abroad trip to Cape Town and Johannesburg, South Africa, and I had the opportunity through the Master of Science in Emergency Management program to do an independent study course to compare the emergency management systems in South Africa to that in the United States. I'd like to start a little bit by just expanding on my introduction and telling you kind of how I became interested in emergency management in an international context. So as you heard, I'm a current student in the program, and I also work full-time for the American Red Cross. And of course, being a full-time Red Cross employee and part of an organization that is international in scope, I have an interest in sort of international affairs, and actually international services falls under my department that I'm responsible for at the Red Cross here in Central Illinois. So you probably are fairly familiar with our disaster services program in the United States, but our international services programs primarily are focused here in the United States on educating people on the Geneva Conventions and the principles of international humanitarian law. But besides that, I've also helped coordinate our local domestic response to international disasters, such as helping reconnect families who have been separated, family members who may be here stateside who have loved ones in other countries who are affected by disaster during recent disasters just like the Philippines. So we have a huge effort going on right now in that regard. In addition to my work responsibilities, I've also traveled abroad several times for mission work with my church, so I've always had an interest in languages and culture. And because of my work and my affiliation with the Red Cross, I'm just very internationally minded. And when Millersville University offered the opportunity for a study abroad trip to South Africa, I really just jumped at the chance. So this summer, I was the only student from the program who accompanied a group of undergraduate students and professors for about a 2-week trip. And the format of the independent study experience was doing some pre-departure readings, and then we had the actual in-country experience, and then I did some further research on my own upon my return home. And I then completed the academic portion of the independent study by writing a research paper incorporating both the in-country portion and my research. So now that you understand kind of the context of my presentation and why I became interested in completing research on the topic of emergency management in South Africa, I'll discuss the outline of my presentation for today. So covering the historical and political background, I believe, is an important context to start out with before we talk about how the actual emergency management system works in South Africa, because just as in the United States, emergency managers have to work within the current political climate, and there's a lot of social and historical factors that influence how emergency management works. It's very much the case in South Africa as well, and it's very important for you to understand that before we talk about how the system works. Then we'll move into a discussion on the risks and vulnerability factors in South Africa, especially in Cape Town. They're extremely vulnerable to coastal hazards and just a wide range of disaster risks. And then finally, we will trace the development of emergency management legislation, policy, and approaches to preparedness, response, and recovery, kind of using the United States model as a lens through which to view this comparative approach to looking at emergency management in South Africa. So as I said, I wanted to start out with the historical background so that you'll understand how South Africa's history still influences the environment that emergency management has to operate in today, particularly in the areas of legislation and policy, but also as we think about some of the social vulnerability characteristics that affect residents of South Africa. So many of you are probably at least a little familiar with the history of the apartheid government in South Africa that lasted for about 40 or 50 years back in the 20th century. But you may not realize that South Africa's legacy of segregation actually began as early as 1913 with a controversial piece of legislation that was known as the 1913 Land Act. And the Land Act set aside certain areas of land as reserves, which amounted to about 7% of the total land in the country for occupation by the native population. And when they say native population, we're really talking about the black South Africans. It also prohibited white South Africans from owning or purchasing land in those native reserves, and prevented black sharecroppers from occupying white areas that were designated for the white population. And while the Land Act was controversial in itself and actually was passed very early in the history of South Africa as an independent nation, since it was passed only about 3 years after they became an independent country, the next significant development in leading towards racial segregation and apartheid happened in 1948. And in 1948, a political party that was known as the National Party won the general election that year on the platform of apartheid. And apartheid really literally means separateness. And the idea of apartheid was to separate whites from the non-whites, along with separating different groups of non-whites from each other. Then by 1950, apartheid actually formally became law, and the first apartheid laws were passed. Over the entire period that apartheid was in existence, there were literally hundreds of different laws that outlined the ways that South Africans would be segregated from one another based on race. But some of the early laws focused on preventing interracial marriages and requiring every member of the population to register their race with the government. And the basic categories of race that were identified by the apartheid government were black, colored, which they defined as persons of mixed race, white, and then Asian, which really composed people of the Indian or Pakistani descent. And they used often arbitrary tests, such as one example that we were told was that they would place a pencil in a person's hair, and if it fell out, the person was considered colored, and if it stayed in, they were considered black. So there were these arbitrary tests that would determine a person's race if it wasn't obvious. And oftentimes, even members of the same family could be split, whereas the parents might be classified as white and their children would be classified as colored just based on how they looked or these arbitrary tests. During this time, over 80% of the land in South Africa was set aside for development by persons from the white race, and they passed a series of laws that were known as the pass laws. That meant that every South African had to carry a passbook that listed their race. And people were restricted on where they could live. And in many cases, they were forcibly removed from neighborhoods that had always been, for example, black neighborhoods, but were desirable for the white population to build upon that land. And they were then relocated to less desirable areas of land, oftentimes the areas that were more prone to disasters, and such as floodplains. And during the period when apartheid was in existence, over 3 million people were forcibly removed from their land and relocated. Also during the apartheid years, an underground resistance movement was growing. It started out with some peaceful demonstrations, some strikes, and they held public events where they would burn their passbooks to make a point, and then eventually led into armed resistance. Even during some of those peaceful protests, they faced extreme police brutality, where police officers would just start shooting arbitrarily into the crowd, even though the demonstration to that point had been peaceful. Members of the opposition movement were also arrested and imprisoned, only to be released when apartheid ended in the early 1990s. During that time, members of the previously opposition movement, known as the African National Congress, became the majority political party in South Africa when the apartheid government ended and they became a democracy. This majority political party, the African National Congress, is still in existence today and holds the majority of the votes in the nation of South Africa. In 1994, Parliament ratified a new constitution, and one of the things that's significant about the timing of the new constitution is that it coincided with a couple of other significant events in South Africa and in the world at the time. In 1994, there was a huge flood in the Cape Flats, an area of South Africa. And the Cape Flats is an area where it was extremely prone to flooding, poor soil, sandy conditions, extremely vulnerable to disasters, and it was one of the areas where some of the black South Africans had been relocated when they were moved out of the areas desirable for white occupation. In 1994, they had a huge flood, and that happened around the same time that the new democracy was forming, and they were identifying what the priorities were for the new government. So as you'll see when we talk about the legislation, that had a huge influence on how the priorities for emergency management were incorporated into legislation. Also in 1994, the United Nations kicked off an international initiative called the International Decade for Disaster Risk Reduction, which took place during the decade of the 1990s. So both of those things had an influence on the development of emergency management as it exists today in South Africa. So we'll turn our attention now to talking a little bit about the political system. And it's important, just as we understand the historical context, to also understand the basic political structure, because it influences how the different levels of government interact with one another and what impact that might have on emergency management. So the Republic of South Africa is a constitutional democracy that has 3 tiers of government. There's a national government, a provincial government, in which there are 9 provinces, and a local or municipal level of government. And rather than thinking of these different tiers of government as being distinct hierarchical levels, they often refer to it as spheres of government. And the reason is because the Constitution defines these different spheres of government as distinct, meaning they each have their own responsibilities, but they are very interdependent and interrelated. Each level of government has both legislative and executive authority within its own sphere. So at the national level, the legislative branch of government is a British-based parliament system, and their parliament has 2 houses, the National Assembly and the National Council of Provinces. Within the National Assembly, there are between 350 and 400 members, and South Africa uses a closed party voting system, meaning that the seats in the National Assembly are awarded to that political party based on the results of the general election, and the members who are chosen to fill those seats are based on their ranking within the political party. So the more powerful you are and influential you are within the majority party, the more likely you are to fill one of the seats in Parliament. Then the other house within Parliament is the National Council of Provinces. It consists of a total of 90 members that represent each of the 9 provinces. And that's an important point of distinction because they're trying to incorporate input from the different levels of government into their national government system in order to make more informed decisions about what benefits the provinces. In addition to those 90 voting members, municipalities have delegates that are non-voting members. And this House of Parliament really helps fulfill a practice that's identified in the Constitution as a priority for South Africa, which is the principle of cooperative governance, meaning that all those three levels of government, those three spheres of government, are interdependent, and their priorities or needs are considered when passing any national legislation. In the executive branch, the executive head of state at the national level is the president, and the president is elected from among the members of the National Assembly, and it's usually a high-ranking member of the majority political party. The president then selects cabinet members from among the National Assembly members and appoints them as ministers over certain functions. And as we'll discuss when we get into the legislation, some of those members of the cabinet have certain distinct responsibilities in coordinating with one another for emergency management purposes. Then they also have a judicial branch, and it's an independent branch that consists of several levels of courts. I would consider that similar to our system in the United States. The highest court in South Africa is the Constitutional Court. Then just a little discussion here on kind of the political environment and the major political parties and how that plays a role in emergency management is important to understand before we move on. Ever since the fall of the apartheid government in the early 1990s, the majority political party has been the African National Congress, and that's that political party that formed out of the resistance movement during apartheid. The most famous member of the African National Congress was, of course, Nelson Mandela, who became president in 1994 after the fall of apartheid. The Democratic Alliance is the strongest opposition party, and altogether there are dozens of different political parties in South Africa. They have many more than we do in the United States, but the Democratic Alliance is the largest opposition party. So as you can tell, the political parties have quite a bit of influence, especially in choosing the members of parliament. They get to choose most of the members of parliament and ultimately the president. And the reason that that's significant to emergency management is because as funding priorities become identified and legislation gets passed, resources and funds are often allocated to provinces and municipalities based on the political party that holds the majority in that area. And that's specifically significant in the area that I visited in the Western Cape province, which is the province where Cape Town is located. Because the Western Cape is the only one of the 9 provinces that's not held by the majority party, but rather it is held by the Democratic Alliance. And the city of Cape Town itself is also largely affiliated with the Democratic Alliance. Because of this difference, many of the local leaders that we met during our trip felt that emergency management functions a little bit differently in the Western Cape than in other areas of the country. And again, that's mainly due to the resource allocations. The majority party is probably less likely to allocate large amounts of resources for disaster preparedness to a province where they don't hold the majority. So moving on a little bit to talk about what are some of the disaster risks in South Africa and how those play a role in priorities and in planning. South Africa is a country that is highly vulnerable to especially natural disasters. Between 1900 to 2013, South Africa ranked second in the number of recorded disaster events, 7th in the number of people affected by disasters, and second in total damages of any country on the African continent. And the reason that it's so highly vulnerable is that a lot of it comes from the weather extremes and climate change factors that are impacted by its location on the coast. Annually, over 500,000 people in South Africa are affected by disasters. Around 60 people are killed, and our economic damages cost about 109 billion United States dollars. South Africa is vulnerable to almost every disaster hazard imaginable, with the biggest risks being droughts, floods and dam failures, urban and rural fires, mining-induced earthquakes. They have a rich history of being a gold and diamond mining country, so they could have some mining-induced earthquakes there. Epidemics, transportation incidents, and hazardous materials incidents. So while we were in Cape Town, we had the opportunity to visit the Cape Town Disaster Risk Management Center. And we can kind of compare the Cape Town Disaster Risk Management Center to the equivalent of a city or a county emergency management agency here in the United States. The city of Cape Town has about 3.7 million people who live there, so it's a very, very large, if we compare it to a city emergency management agency, it's a pretty large agency that has responsibility for a lot of people. During our visit, we spent an entire morning with the director and his department heads, and they gave us a series of presentations on the most frequent risks and how they address those risks. So one of the presentations that we had the opportunity to hear was about their hazard risk analysis. And within the city of Cape Town, they have a very diverse set of risks. They have both formal and informal residential areas. We'll talk a little bit more about those in just a minute when we talk about some of the fire and flood risks in the informal settlements. They have commercial areas, agricultural areas, they have nature reserves and a national park, and then they also have pretty extensive tourism. A lot of famous people from the United States even go and vacation in Cape Town, and they've played host to a lot of major events such as the 2010 World Cup. They have a lot of extreme weather because they get the cold currents from the South Pole plus warm currents off the African coast from the north. And the closer the cold front comes, the worse the storms that they have. So from their hazard risk analysis, some of the priorities that they've identified as high risk that they should devote a lot of their planning efforts to are flooding and severe storms, structural fires, drought, heat wave, coastal hazards such as storm surge and coastal erosion. And then they also could experience some stranded sea animals, oil spills, and harmful algae blooms just as a result of being located there on the coast. Their medium planning priorities are for earthquakes. That same area that I mentioned in the Cape Flats that's vulnerable to flooding could also, they mentioned, be vulnerable to liquefaction during an earthquake because of the type of soil that is present there. The disruption of the power grid or other essential services would also have a huge impact on them. It's only been in recent years that their electrical supply has been actually reliable to avoid a lot of outages. In fact, we had one outage while we were there, but a few years ago that would have been much more common. So they could experience disruptions for a lengthy period of time to essential services, and that could have an impact. And then, of course, dam failure, wildfires, and hazmat incidents. And then some of their kind of low probability but high impact events that they consider are epidemics, nuclear power plant incident. The city of Cape Town has the only commercial nuclear power plant on the African continent, and it does supply power to the electrical grid. So besides the impact of a radiological incident, they could also experience a power disruption from an incident at the power plant. Transportation incidents like shipping incidents, a structural failure like a bridge collapse, terrorism, a pest infestation or plant disease that could affect their food supply. Although their food supply is a lot more reliable than other countries on the African continent, a significant event like a drought could cause a pest infestation could cause a pretty significant disruption in the food supply. One of the areas in and around Cape Town that experiences a lot of vulnerability to disasters from a social vulnerability perspective in particular are the informal settlements. The informal settlements really grew out of the post-apartheid era, and when the apartheid laws were repealed and the new constitution was ratified, then people had a lot more freedom to live wherever they choose. And because a lot of the economic opportunities were in the bigger cities, and the bigger cities had traditionally been areas where the white population dominated most of the housing, when black people started being able to move back to the cities, they had to find somewhere to live. And there was a huge shortage of available, affordable housing. So a lot of informal settlements crept up in the areas in and around Cape Town. And today, it's estimated that at least 193,000 families live in 200 different informal settlements in and around Cape Town. These homes are constructed out of whatever available materials they can find, and they're often, because they're not planned development, the homes are located in very close proximity to one another. And besides the disaster risks in these communities, which we'll talk about in just a minute, everyday life in these settlements is very challenging. They have a huge prevalence of health-related issues, and especially HIV and AIDS. In one of the informal settlements that we visited, we were told that the HIV/AIDS infection rate in that particular settlement was around 95%. And that's very significant, even as it compares to the statistics in the country at large. Because the infection rate in the entire country is around 25%, which is still high. But in some of these informal settlements, the numbers are much higher. Some other health-related risks are that settlements do not have adequate sanitation. And in one of the settlements we visited, we were shown kind of a crude building. It was erected very much out of the same materials that you see in the picture here that the homes are constructed from. And we were told that that building contained one toilet that was used for approximately 20 families. So sanitation is a huge problem in these settlements as well. Families do often live in extreme poverty in these settlements, but a lot of them do have jobs, and they spend a lot of their time and energy either working or looking for jobs. And that kind of contributes to the fact that they don't necessarily put a lot of time and energy into working on improving their community or things that they could do to reduce disaster risks. So all of these factors create a huge social vulnerability to disasters in these settlements, which is not very easy to address. One of the biggest risks in the informal settlements is fire risk. They have a very high frequency of serious fires. Because of the type of building materials that these homes are constructed from, the fires can spread very, very quickly. Since the settlements are not planned developments, the streets are very narrow and they're very difficult or impossible to get a fire truck down the street. Some of them literally do not even have streets in between the homes. There may be they may be 5 or 6 homes deep on a hillside, and there's literally no road in between the homes in order to get a fire truck through. They have very few or very little fire hydrants in these communities as well. Since the homes are built almost on top of one another, it allows fire to spread very, very quickly from one home to the next. And a fire in one home often burns several homes or a whole row of homes. High population in a small concentrated area also contributes to risks. Some of these settlements, even if they were kind of created with some planned development in mind, they were not created to house the number of residents that these settlements currently have. One of the settlements that we visited, it was estimated, was planned to accommodate around 3,000 residents, but today they think there are about 20,000 people living in this settlement. Since there's very little planned development in these settlements, the electricity is very informally connected, and often neighbor to neighbor might just rig up a very informal electrical wiring in order to give their neighbor some electricity when someone new moves to the area. Besides that, residents also use paraffin stoves and for cooking, and paraffin is highly flammable. And without proper education, residents may not realize that water actually helps fan the flames, and it does not put the flames out. They need to use sand in order to put out those fires, and if the residents aren't properly informed, they could actually do more harm than good if their paraffin catches fire. And the picture that you see on the screen is from an actual informal settlement fire that happened while we were in the area. We were driving one day from one place to the next, and we're going to turn down this road to get to where we were going, and we're told we had to turn back because there was a fire, so we avoided that. But it's a pretty common occurrence in these informal settlements. So in the top picture, you can see that there's an example of the informal wiring that's been rigged up to allow people to have electricity in these homes. So there's too much electrical power being drawn from one access point. And as we walked around these informal settlements, we could see that the wires were draped across roofs of homes. They looked like spaghetti wires because they were so tangled and strung from one place to the next. People's risky behavior often creates a fire risk because, again, they aren't sure how to use paraffin. They include unsafe cooking practices. And sometimes, like people in other settlements, they'll come home drunk and not realize that they're contributing to a fire risk by the behavior that they display while they're drunk. One community leader in the research that I examined described the problem as people need to spend so much time working or looking for work that they don't invest time in making their community better. And so I think one of the things, if this environment is going to change and we're going to improve upon this situation, one recommendation would be to build on the fact that these informal settlements often have a block leader or a street leader who's kind of the informal leader within the informal settlements. And if we could build on that and train people almost like a CERT team approach like we have in the United States, then that might be one way to rally neighborhoods together and help train them on the proper safety procedures and helping their neighbors in the event that first responders can't get to them quickly. People also, despite best efforts around education, and people also tend to build their homes extremely close together. When we talked to the Cape Town Disaster Center, they said after a disaster, after a fire, when homes are rebuilt, they try and discourage people from building them as close together, and they try to educate them about how they need to space their homes out more to reduce the fire risk. And they said, you know, that might work for a certain period of time, but then new residents move in and they see an available piece of land and they put their home right there on that piece of land. And as I mentioned, the narrow streets or the lack of streets make it impossible for fire trucks to get there. The bottom picture on the screen is a picture of the former fire station in one of the informal settlements that we visited. And we were told, as we visited the scene of a fatal house fire in one of the settlements, and we were told that what took us about a 15-minute walk from the fire station up to where this property was located, it took the fire department at least an hour to get there because they had so many challenges getting through. This home was up on a hillside, and again, they were 5 or 6 homes deep, and they just couldn't get to the area. And this is a picture of that area where the fatal house fire happened. You can see that there's not much left of the home, just scraps really. And this is the fire that I mentioned when the fire truck took almost an hour to reach the home, and the one woman unfortunately perished in this fire. So the day that we were there, it was about a week after the fire, and the residents in the neighboring homes were kind of going through and cleaning up the debris and getting rid of what was left there. And unfortunately, sadly, probably someone else will rebuild on that same site because that just seems to be the pattern that these folks are in. Besides the fire risk, the informal settlements also have a huge flood risk. Because the land that these settlements are built upon are often floodplains, they don't have planned development, so there's no stormwater management plan or storm sewers. There's no plan for debris removal, or even people aren't really educated about what happens if they throw their trash down in what few drains there are and how that can cause water to back up and flood their homes. Because of the land that these settlements are built on, they have recurring floods that happen almost yearly during the rainy season. And this picture shows the aftermath of a flood that happened while I was there, and we had visited this informal settlement just a couple of days after the flood, and you can still see the puddles of water sitting here. These two pictures show an example of, the bottom right is an example of the stream that flows through the center of the village and kind of caused part of the problem with the flood. And one of the things that was really sad to me is that there were children playing in all the flood water as we walked around town. And there didn't seem to be, I asked about any plans for education or outreach to the residents on how to talk to their kids about floodwater safety and how they really shouldn't play in the floodwater because of disease, and I was told that there is no formal program for that. So in the top picture you can see that there was actually one sort of storm sewer drain in this community, and it was all blocked with debris and trash, so it wasn't very effective in helping the water flow through freely. And this picture shows, you can see that all that's left of one of the areas that had flooded is just literally the dirt where the homes had been built. The flooding was so severe in this area that they literally came in and bulldozed what was left of the homes to get rid of the debris. So now that you understand some of the risks in the historical and political context, I'm going to turn our focus for just a couple of minutes on how the emergency management system works in South Africa, and I'll start that with the relevant legislation. So in the United States, we have the Robert T. Stafford Act that is really our centerpiece of emergency management legislation. They have something similar in South Africa, and it's known as the National Disaster Management Act. And in a British-based parliament system, there's a series of procedures that the parliament goes through before they pass a piece of legislation. And it usually starts with what's called a green paper. So back in 1997, the parliament issued a green paper on disaster management. And the purpose of the green paper was to really identify the broad issues that should be considered in a piece of emergency management legislation. And they were very intentional about including a mitigation and prevention component to this legislation, which is very progressive, because if you've ever taken a look at the Stafford Act, primarily it outlines how the national government, the federal government in the United States, will provide assistance to state and local governments. There's very little in there, with the exception of the federal mitigation program that is primarily enacted after disasters. There's very little in the Stafford Act about prevention and mitigation. And probably because of the time period in which this legislation was issued and what was going on in their country at the time and what was going on with the United Nations International Decade of Disaster Risk Reduction, they were very progressive in their thinking in building in a prevention and mitigation component. It also included a preliminary assessment of the capacity at all levels of government, so they could kind of get a baseline for what progress they needed to make and what resource constraints that they would have in doing so. So after the green paper identified those broad issues, they widely disseminated it and held a series of workshops to get public feedback and comment. And the next step was to issue a white paper on disaster management. And in this type of a parliament system, the white paper really forms the basis for drafting a bill that will be presented to Parliament eventually. Again, the white paper continued to build on what was identified in the green paper as a priority by emphasizing the importance of preventing disasters rather than just responding to and recovering from them. The white paper recommended integrating risk reduction activities into plan development strategies and developing minimum standards for housing. It also recommended the creation of a National Disaster Management Center to coordinate information across all levels and spheres of government and serve as that central repository of disaster data. Prior to this, they really didn't keep any records of disasters, at least formally, in the country in any centralized database. So in order to inform future planning considerations, they decided it was a good idea to keep a database, and the National Disaster Management Center was kind of the keeper of that data. The next step after the white paper was that the National Disaster Management Act was formally signed into law in 2002. And part of the act, in addition to mandating that National Disaster Management Center, was to also outline the duties of the different spheres of government and figure out who was financially responsible for different actions, and then to require the development of a national disaster framework. And similar to how we have the national planning frameworks in our federal government, their legislation required that they have a national disaster framework. So one key difference, in addition to that prevention mitigation focus, one key difference between the South African approach versus that in the United States is that they take more of a top-down approach in mandating actions that will happen at the provincial and local levels. And that's mostly possible because of their system of government. Because of how our system is set up in the United States, the federal government can't really mandate certain planning actions. They can only seriously encourage them, so, or to do that through financial incentives like grants. But in South Africa, they were really able to mandate that the lower levels of government would be accountable for submitting a written disaster plan to the next level of government for approval, and also creating provincial and municipal disaster management centers as well. So that Cape Town Disaster Management Center is the municipal, that's the municipal center for the city of Cape Town that was mandated by this disaster legislation. And here in this series of pictures, you'll see that their emergency operations center looks very similar to what we would have in the United States. And the larger picture in the middle is really where their command center would be in the event of a major disaster affecting the city of Cape Town, where they would pull in all of their partners and use that as a coordinating mechanism. So the National Disaster Policy Framework was mandated by the National Disaster Management Act, and it was released in 2005. In the planning frameworks, it identified 4 key performance areas. One is this principle of cooperative governance between all levels of governance. So it identified a series of planning and coordination groups, and an example of that is at the national level they have an intergovernmental committee on disaster management that's made up of cabinet members and council members from each province and members of municipal councils as well, and they kind of form the strategic perspective on how emergency management should function in the country. They also, another one of their priorities is to identify and quantify disaster risk, so again keeping records on disasters. Introducing disaster risk as a fundamental component of development plans, and really this idea of prevention and mitigation being incorporated into plan development so that communities can be built with disaster prevention in mind as they are developed. And then the last priority is developing a coordinated approach to the rapid and effective response and recovery. So things like early warning systems, how to classify and declare a disaster and who's financially responsible for that within the country, depending on the scope, and then allocating that coordination responsibility to one level of government in a single organ of state. So as compared to the United States, it's very similar in the approach. Their 4 key performance areas can be compared to the 5 mission areas that we have in our national planning frameworks, which help ensure a comprehensive approach. So one of the major differences is that South Africa's framework mostly incorporates roles for the different levels of government rather than the whole community approach that we are trying to take in the United States, to integrate the private sector and community organizations and non-governmental organizations. There's some reasons for that, which I'll discuss in just a second as we kind of talk about how it actually functions. I just want to mention briefly that South Africa does not currently mandate the use of the incident command system. In that regard, they're kind of a late adopter, as it's a lot of other countries around the world have now adopted the incident command system, but they formally do not have a mandated coordination system. They've taken a lot of strides towards that, and I believe that it probably will happen in the future. Every year they hold an annual summit in which they discuss kind of what the next phases are of exploring this idea of adopting incident command system. And they've actually partnered with the United States and sent responders over to observe how it works on some of our larger wildfire incidents and come back and use some of that in their own planning as well. And one of the reasons why it probably hasn't been adopted as quickly as in some other countries is because of those distinct interdependent spheres of government. Different agencies are afraid of giving up control of their operations and working together in a coordinated fashion. But just as recently as June 2013, they had a summit to discuss kind of their priorities, and a lot of the key players in emergency management in the country are now clamoring for the nationwide adoption. So just to wrap up in the next couple of minutes, I want to kind of talk about how preparedness, response, and recovery work in South Africa. Disaster preparedness in South Africa is primarily a municipal government responsibility, and because of that, capacity varies greatly from municipality to municipality. Cape Town is very, very progressive and has been identified as a model United Nations city for disaster risk reduction, but there's an extreme lack of progress in other municipalities. It could be due to the political environment, or just, I have a feeling it's more due to the resource constraints, because they're trying to address a lot of other social problems, and they haven't gotten to the point where they're able to budget for preparedness initiatives. The Cape Town Disaster Risk Management Center has formed cooperative task teams that plan outreaches to different vulnerable populations, and they integrate that into the city's 5-year strategic plan, which means that it is a line item in their budget. Some of the innovative ideas that they have done to reach people are they have a partnership with a theater company where they go around to the informal settlements and they do a live drama presentation on floods, and they have another one on fires, and they illustrate to people some of the preparedness steps and proactive behaviors that they can take to reduce the risk of fires and floods in those communities. And those have been highly successful, and they hit about 20 different informal settlements every year. And they also then try to reach people through a variety of mediums such as social media, the internet, radio, and door-to-door outreach. And even with these innovative approaches, the social vulnerability factors discussed earlier make it really hard to see any significant improvement. You know, when people are worried about their day-to-day survival and how they're going to get food, clothing, and shelter, they really aren't in a place where they can think about preparedness. And I know we see that in the United States too, but it's really kind of even compounded further in South Africa. During response, the municipal government plays a very similar role to that in the United States, and the municipal government is responsible for initiating the response and providing that local coordination. They also are responsible for notifying the provincial government, and ultimately, if it's large enough in scope, then the provincial government will notify the national government so that some resources can be allocated to that. And one thing that I found was significant is that Cape Town also maintains a roster of disaster response volunteers who can help the city during a disaster. And the municipal centers, the disaster risk management centers, are required by the emergency management legislation to maintain a disaster volunteer program. So in Cape Town, they organize the volunteers into different geographic areas and have regular training and exercises with these volunteers. And they have been able to help with things like crowd control during the World Cup, in addition to responding to disasters. The role of the non-governmental organizations in disaster response functions just a little differently, at least in Cape Town, than it does here. There are 5 non-governmental organizations that help with feeding during a disaster. And rather than calling upon all 5 of those every time there's a disaster, they have a rotational system in place where one time the government might call out the Red Cross, another time the government might call out the Salvation Army, or the other 3 NGOs that are more local, grassroots in nature. And they just really all take turns. And they only respond at the request of the government, which is a little different than here. They also focus just on that initial feeding for about 3 days. Beyond 3 days, the government usually says there's no more need for feeding. You can go ahead and cease your operations. On really large disasters, they might extend that time frame by a few more days, or they might call in all 5 non-governmental organizations and just divide the area up into quadrants so that each non-governmental organization has a geographic area that they're responding in. As they transition out of hot meals, they then will provide food parcels to kind of help with that transition period for the families to transition back to self-sufficiency. And in the Western Cape only, so in that province only, the government actually reimburses the Red Cross and other NGOs for their expenses in feeding. In other provinces in the country, and again, I think this is because of the political differences, but in other provinces, they rely more on the private donations from individuals and corporations, just like we do in the United States. And the Red Cross was actually in the middle of a flooding response when we visited their provincial headquarters there in Cape Town, and so I was able to see them in action. That picture on the bottom left is kind of their command center where they would be cooking large amounts of meals, and I thought we had large pots here, but they have very large pots that they cook in and take the food out to the families. And then the top right picture are the warehouse where they store the items that would go into a food parcel if they need to. And then transitioning into recovery. Recovery is primarily a municipal government responsibility. Unlike the United States, where oftentimes communities will form a long-term recovery committee and the NGO community really steps up to take the lead in that. And the faith-based community is very influential in that, and other partners such as the Salvation Army and Red Cross are involved in that as well. That is not the case in South Africa. And the reason for that is because the NGOs in South Africa are so busy addressing the everyday social issues, such as improving education and access to health care, that they don't have the capacity to assist with much beyond that very brief window for immediate response. And because it's a municipal government responsibility, like many of the other initiatives I've described today, it really varies from municipality to municipality what the government is able to do for folks in recovery. The city of Cape Town is kind of a model in this regard as well, because they actually do some proactive outreach to people. They form a special task team that does outreach for mitigation activities during their recovery phase to help communities build back better, so that they aren't just building in the same locations really close together and having the same issues again during the next disaster. They also give each family a basic housing kit, which contains about 10 wooden poles to construct a housing frame, 5 sheets of zinc that are used to construct the roof, a door frame and a door, and a hammer and nails. And it's kind of a do-it-yourself housing kit that they can use to construct a new dwelling for themselves. And the cost of each kit to provide is about $140 US. So while Cape Town is the model, in many municipalities, little or no disaster recovery takes place due to resource constraints. So just to conclude, and then I'd be happy to take your questions, much as emergency management in the United States functions within the existing political and historical context and resource constraints, that is very much the case in South Africa as well. And while South Africa still has probably a lot of progress to make in order to be even more disaster resistant and build resilient communities, they are actually a model for other African nations. And a lot of what has been proven to work in South Africa is being looked at as a model for use in other African nations as well. So I see that I have a couple of questions in the chat, so I'll go ahead and take those. Let's see, it looks like mitigating these risks and educating people. I covered that just a little bit, so I'll see if I've answered your question. But I think one of the things to keep in mind is that there are a lot of root causes to disasters that are not easy to address. Just like those social vulnerability factors that we've studied throughout the program here at Millersville, those are very much everyday realities in South Africa. And educating people only goes so far because, again, as I mentioned, they don't have the basic necessities of life, so it's very difficult to focus on disaster preparedness. There are places that do try, just as the city of Cape Town, to go out and do some proactive outreach. The director of the City of Cape Town Disaster Risk Management Center did tell us that, besides that limited assistance that they're able to provide during recovery, where they help provide guidance on how to rebuild, they don't have enough resources to address the root cause of the housing shortage, and enough resources to address the root causes like mitigating some of those risks with actual tangible items. The relationship between settlement density and informal settlement fires. My research really didn't get into that specifically, but I can tell you that the settlements were not built to accommodate the large numbers of people that they do have now. So I am sure that probably does play a factor in increasing the risk. And just the example I gave earlier in the presentation, where the settlement was built for around 3,000 residents, and now today they have an estimate of 20,000 people who are living in that one area, just really contributes to a lot of the problems, I think. And it's even hard to get good data on how many people live in these settlements, because day to day there are people moving in and out and new homes being constructed and things like that. Are there any other questions?
Keith, you can go ahead first.
Yes, thank you first for your presentation, and I just want to know if, do you think there is any way out of informal settlement in South Africa, or is these people will be living in those settlements forever.
I want to make sure I understood the question right, so I'll try to rephrase it for you and see if this is what you're asking. Are you asking about whether there's any hope for addressing some of these challenges, or whether they'll continue for some time? Is that what you're asking?
No, I'm asking, is there any solution that South Africa is putting up there to resolve the challenges, the issues of informal settlement?
We had some lengthy conversations about that when we met with both the director of the Cape Town Disaster Center and the leadership of the Red Cross and some other local folks that were kind of showing us around. And it really all comes back to a lot of those social vulnerability issues. The main thing that I think needs to happen in order to address the problems in the informal settlements is for there to be actual permanent, safe, affordable, available housing built in large enough quantities to accommodate everyone who needs it. And there just right now is not the resource availability, either money from the government or even personal resources among the family members to be able to address that challenge. So that, I think, is the key to reducing the problems in the informal settlements, is addressing that housing issue. Some of the local people also told us it's not as simple as that sometimes even when a home becomes available, the people don't want to move because it's what they're used to. We have the same conversations here in the United States. It's just different. Here in the United States, people may live in a floodplain and that's the only home they've ever known, so they don't want to move even if they're offered the opportunity to buy out. Well, over there, it's kind of the same thing. Even if a home becomes available, in some cases, due to proximity to work or the fact that they've always lived there or their family's there, a lot of different reasons, they may not want to move even if that home becomes available. But there is a waiting list for safe, affordable housing, and unfortunately it just can't be addressed quickly enough in order to help address that challenge. Yes, Pascal.
Yes, but you see, I am from the Congo. The Congo is in Central Africa, and you say South Africa is a model for other African nations. Now, you say this based on what you see on the ground in South Africa, or based on the policies of emergency management on paper?
So are you asking how some of the preparedness initiatives in South Africa could be translated to other countries like the Congo?
Yes, so
okay, well, I think one of the ways that could be able to happen is, as we think about how, whether it's the United States or another country, the way to reach people with preparedness messages really depends on their culture and how they receive information and how receptive they will be to the message in whatever format it's presented in. So I think an application and taking the lessons learned in South Africa to translate to another country is really figuring out, how does the community prefer to get their information? Are they an oral tradition, or do they prefer to get their information in written form, or kind of how does the community receive information, and what are some of the traditions in the community that you could build upon in order to impart that information? So in South Africa, for instance, they have a legacy of oral storytelling. So that's why the theater productions in which the concepts are presented through an interactive drama with audience participation are very successful there. And I think translating some of those same approaches to what works in that community may not necessarily work exactly the same way in another community, but you could certainly find out what works in that local context and translate it there.
So I know we are out of time, but one quick last question. So I know apartheid is over in South Africa since 1994, and do you think there is no biases when responding to emergencies or to disaster in South Africa? Because I know we after Katrina in the United States, well, people are complaining about the biases between different people. So do you think South Africa is over that?
You know, that's something I actually would like to delve a little bit more into, because I was actually struck by the fact that when I was there that they seem to have almost gone above and beyond in order to embrace diversity. They consider themselves the Rainbow Nation, and they have 11 different official national languages, and even in Parliament, anybody can speak up in any one of those 11 officially recognized languages, and they have to be accommodated. And I think from my experience and observation there, it seemed to very much be that while I'm sure there's still a lot of feelings in how the past unfolded and their history, I think that in a lot of cases they have, as a society, really tried their best to get over that. And one of the ways that they did that in the fall of apartheid was through the Truth and Reconciliation Commissions, in which people were able to address some of those challenges and people that had wronged them in the past and bring them, you know, there was healing in that process because they were able to confront people that had wronged them in the past and treated them unfairly, and figure out how to address that going forward without retaliation. And I think having addressed it that way, I think it's gone a long way towards addressing some of those challenges, but I don't think they're there yet by any means. But from an external observer's perspective, it seemed very much like they have tried their best to almost overcompensate and do their best to embrace diversity in the country. And I didn't run across anything in my research, and I would be very interested in exploring that a bit further and how that translates into emergency management, and whether in fact there is discrimination or issues of race that come into play during disasters.
Okay, thank you.
Thank you. Shauna.
Hi, Alyssa. I just have one more question before we wrap up today. So I was just wondering, from the standpoint of a U.S. citizen going over to help, is there any training that you go through before you are deployed on things like cultural awareness? And we talked a lot about the government. Is there any training for that in the historical context before you go over to deploy to a different nation like South Africa? And what courses or training would you recommend for young individuals who are looking to become integrated into this field?
Are you asking specifically with the Red Cross or just in general?
Specifically with what you do with the Red Cross, or in general as well.
Okay. Well, from a Red Cross perspective, how it works in a nutshell is that if we deploy disaster relief specialists to another country, it's at the request of that host country. The host country Red Cross Society gets to determine kind of how much assistance they need and what form of assistance they need, whether it's in terms of just financial assistance or in the form of volunteers. So for example, for what's going on in the Philippines right now, the American Red Cross has sent 9 disaster relief specialists over to help with very specific things like communications and sanitation. But primarily what the Filipino government has asked for is financial assistance. So within the American Red Cross, we have it's a very select process to be approved for the international team. Really what the selection criteria would be are, have you lived abroad for an extensive period of time before? We don't want to send somebody on a disaster for their first experience staying abroad, or they're going to experience an extreme amount of culture shock. Do they have basic familiarity with a language so that they could communicate effectively in another country? And then do they have some kind of special skill? A lot of the folks that we deploy are actually communications experts that can go in and set up like satellites in order to facilitate internet and phone connectivity in some of these remote areas that have lost communications. Or other areas of specialization might be in sanitation or water purification or supply distribution. So those are really all of the criteria that the selection team looks at. And then there is a specialized training course that those international delegates go through in order to be part of the international team. And just to give you some perspective on how select that group is, I believe there's something like 80,000 volunteers in the system for domestic disasters, but there are only a few hundred on the international team. So it's very select to be approved to get on that. And then I think just in general, a lot of those same principles apply if somebody wanted to be affiliated through another avenue and go on international disaster deployment. I think a familiarity with what it's like to live and work in a foreign country is very important. I'm glad that my experience in South Africa, even though it was only a short-term experience, was not my first experience out of the country, or I think I would have experienced a lot of culture shock. So having a familiarity with a language, again, is going to be beneficial. And then if you are asked to go to a very specific place, I think doing a lot of research on what are the cultural norms of that country, what is the political and historical context, what significant laws are in place that will impact our work. And then finally, also understanding the how international humanitarian response works and the coordination that takes place with the United Nations and how the different NGOs work together within that cluster system. And so actually Dr. Kirsten Bookmiller teaches an excellent course in the program called International Humanitarian Response, which I took this summer that I'd highly recommend if somebody is interested in exploring the idea of international relief further.
Thank you. That was a great response, and it was exactly what I was looking for. So thank you. That makes a lot of sense. If there are no other questions, then we can go ahead and wrap it up. I would just like to thank you, Alyssa, for, oh, we do have another question, but before I go, I just wanted to thank you. I thought that was an incredible presentation and very informative, very shocking, sad reality in some cases, but Pascal, if you have anything to say, go ahead.
Last question, Alice, I forget this. I know South Africa they have like 11 official languages. So do they have to translate their emergency management policies in all 11 languages, or how would they do this?
In terms of policy, yes, the 11 officially recognized languages, if someone wanted to read a policy in one of those languages, I believe they would be required to make it available in that language. And for example, if someone were to observe a session in Parliament and see legislation being passed, if they wanted to hear it in another language, they have a system that someone can plug headphones into and get the translation. So they do make that widely available. I will say too that although there are 11 official languages, many of those are tribal languages and they aren't very prevalent except in some of the more remote areas. So everywhere that we went, English was widely spoken. So that's kind of a universal fallback in the event that someone can't communicate in one of those tribal languages.
Thank you.
Okay, well, thank you, Alyssa, again for your wonderful presentation. And thank you, everybody else, for all your intriguing questions. And if there are no more questions, then have a great afternoon and have a great weekend.
Thank you.